In this episode of Side by Side, we hear from Professor Michael Levy from Harvard Medical School as he shares his insights on shared decision-making from the physician's perspective. Let's hear from one of the top experts in the field.
My name is Michael Levy. I'm an associate professor at Harvard Medical School and a neurologist and neuroimmunologist at the Massachusetts General Hospital. I've been here about 5 years. I started my career at Johns Hopkins Hospital, where I was a resident and fellow in neuroimmunology, and stayed on the faculty to build the neuromyelitis optica clinic in about 2009, and then moved here in 2019. Shared decision-making means that all of the power is in the hands of the patient, and the role of the physician and the family is to guide the patient, help them think through all of the issues. As a physician, I present the data, drug efficacy, safety, logistics. I try to give as much information as possible in an unbiased manner. And then the patient and their family members help apply their priorities to that data to come up with a best solution, best plan forward for the patient. The ideal doctor-patient relationship is free communication. So that allows the patient to tell me everything that they need to tell me and that they want to tell me. And then I can tell the patient everything that's honest and true about what I know about their disease and the medications and their prognosis, and then we can have an honest communication about the best path forward. I find that it's important to establish a level of trust before the patients tell me what their priorities are, because sometimes they don't feel comfortable talking about what their priorities are. They may expect that I'll just have one answer for them. Sometimes it takes time to open up, and it may take a few visits before I really understand all of their priorities, and sometimes it takes more visits for them to understand all of the data that's been generated for their disease. So this is a process that evolves over time. It's a relationship that builds. It's not just a one-time, here's your question and here's your answer. It's really a relationship, and it lasts years and years. It's been my experience that this shared decision-making model does result in better outcomes. Compliance is key for these medications to work. We know that if patients aren't sticking with their medications, that NMO, MOG, all these diseases are just going to roar right back. If we're pushing a medication or a treatment plan on a patient who's not really buying into it, they're much less likely to stick with it. So it has been my experience that when patients say, this is what I want to do and this is how I want to do it, they're much more likely to do it. My advice to patients is to be your own advocate. Open up with your doctor. Don't be shy to ask questions. Especially don't be shy to challenge your doctor. If your doctor says, I think this, and you think something else, bring it up. Have a conversation about it, because this is ultimately a shared decision-making model and a partnership rather than a one-sided conversation.
Let's recap what Dr. Levy said about shared decision-making. The physician's role is to guide the patient, present the data, and provide as much information as possible in an unbiased manner. Power in the hands of the patient. Patients and family members help apply their priorities to that data to come up with the best plan forward for the patient. The ideal doctor and patient relationship is based on trust and free communication. It's important to establish a level of trust for both sides to be open, honest, and feel comfortable to speak about all possibilities of treatment. It takes time. Shared decision-making is a process and a relationship that builds and ideally lasts for years. It takes time for both sides to fully understand priorities and the data while finding the best answers for each patient. Shared decision-making results in better outcomes for patients. If you feel good about your therapy, it is much more likely that you will stick to it. Be your own advocate. Challenge your doctor. Have a conversation in a respectful manner when you have a difference of opinion. It is a partnership after all, not a one-sided conversation. To help you prepare for an upcoming appointment, please visit the Samire Foundation's global website to access resources about shared decision-making. The links can be found in the description below. In the meantime, we invite you to share your experiences in the comments below.